That means 50% of Jewish women who get breast cancer could be, 50% of women who develop ovarian cancer could potentially be prevented from getting that disease. I think that's actually quite possible. Half of the ovarian cancer happening to women under 50, under 60 in our community don't have to have that disease if we had a way to find them, because we can prevent it with prophylactic oophorectomy after they finish having children. That's a big message. But it's a big message we're not hearing because it really isn't the same message for the general population, because this gene is rare in the non-Jewish population. It is not rare in the Jewish population. And we don't really have a good method for separating out and pointing to the group in whom the benefit could be made, as opposed to the group that the benefit is going to be small but very hard to find. We also can prevent or detect earlier breast cancer in young women, because this disease, when it is from the gene, can occur so young, and that's at least a fourth of women who get breast cancer under 50 in this Ashkenazi population. Detection is tougher. Detection is tougher in dense breasts in younger women, and the cancers are often more advanced, not because of the gene, but because of the age. So this is a difference that we can make. What are the obstacles? Why don't people do tests? Are we afraid of discrimination? Are we afraid of the motion? Do we distrust it when people say, oh, no, nobody's going to find out, nobody's going to discriminate against you, we don't want to talk to our family? Is it the cost or misinformation? It's all of those things. Okay, so here I really want to ask you this for a second, because this was a patient who touched me greatly. This lady was 83 years old when I met her. She had actually had her diagnosis of breast cancer a few years before, and because of her age and really because of her depression, she ended up having sort of a less than normal treatment. She didn't get the radiation therapy, so it came back, but she is still doing fine, still very localized. But the depression was all about this situation, because she lost her daughter when she was 45 years old, and it was so clear to me that she was still very, very sad about that. It had been about 10 years, but she just was really sad. And understandably. And she couldn't understand really why I was interested in doing this gene testing. There are a lot of other children, by the way, over here, other nieces and nephews, not affected by cancer, however. So this son and his wife came in, and we talked a lot about the genetic testing. And we ultimately did find that she had a mutation of the BRCA1. And the day that I told her about it and was explaining the results and explaining how we should test her son, she kind of looked at me, and I knew she was feeling worse than ever. Because she was already feeling bad, and now she's feeling like maybe she had caused her daughter's cancer, or maybe there's something else that could be inflicted. And I could just see her sinking a little bit lower and being a little more brokenhearted. And I said, now I want you to look at this and reframe it, because here's the facts. First of all, this gene is 700 years old. You have nothing to do guilt-wise for that. I know it makes you sad to know your daughter got it, but the fact of the matter is it's not from you. The second thing I want you to realize is that something changed today. The thing that changed today is that if your daughter had never had this ovarian cancer, well, you can't go back that way, but let's just say we didn't know